Hello, my name is Sadie Millard, and I chose to do my micro lecture on the podcast entitled Pain Management Doctor Was a One-Man Crime Wave. A little outline of what I'll be presenting over today is an overview of the case concerning Dr. Charles Fred Gott, the impacts it has had, how he got caught, and prevention tactics, and then how the scenario connects to healthcare law and policy. An overview about the case was Dr. Gott was originally a cardiologist, but was a pain management physician at the time of this case. He became one of the highest prescribers of opioids, specifically methadone, because of its scarcity and how much the patients needed to come back. Scarcity was the fact that not a lot of healthcare providers were providing the methadone drug at this time, so if they needed it, they would have to go to him. And at the beginning of getting a prescription of methadone, patients would have to see him every week and then every 2 weeks, which was a lot more frequent than most other drugs, which is usually about a month. Also, by seeing his patients this often, he was getting money in a pretty fast, timely manner compared to his cardiologist job, which was not profitable enough for him. So in the end, that's why he went into becoming a pain management physician. So how he got caught was that the United States Attorney's Office became suspicious because of a few different factors. He was performing EKGs on his patients, and he also performed spirometry tests on his patients every 3 months, which these two tests are for people with respiratory problems when his patients were coming to see him for pain management problems. And then once they did get a search warrant on Gott, he stopped billing the patients for the test to kind of cover up what he was doing. The impacts that he's had, it's named one-man crisis wave because his ability to cause a major source of damage in a small rural community, and it does cascade. It starts from the patient, impacts the patients, their ability to hold a job, their health, their financial stability, and then it does cascade into affecting families and the communities themselves. Some prevention tactics that they've tried to implement in order to uncover and expose these healthcare providers that are over prescribing opioids. HHS partners with federal law enforcement agencies such as the DEA, FBI, and state Medicaid fraud units, and then new opioid fraud detection units have been incorporated. They have lots of data resources to help identify doctors who are over prescribing opioids, and they also have hired opioid prosecutors to work on these specific cases. So some ways that the one-man crime wave relates to the class, there's a few key terms that help describe the actions that were performed by Dr. Gott. They include non-maleficence and maleficence. They're doing no harm versus doing harm. Malpractice, which is the improper or immoral conduct in the performance of duties, either intentionally or through carelessness or ignorance. In this case, it was intentional. And then patients went to Dr. Gott to relieve themselves of pain and put trust into what he told them. He went against what is right and negatively impacted many people's lives. So some ethical and legal issues include medical ethics, which was a disregard of patient welfare, and he ended up contributing to the opioid addiction rather than offering pain management remedies. Another way that there were issues is the healthcare fraud. He was billing for unnecessary procedures, and actions were only for financial gain rather than patient health. Some acts that were also violated were the False Claims Act, where Dr. Gott knowingly submitted false or fraudulent claims to federal programs, and he also tried to cover it up once the attorney's office tried to expose him for prescribing methadone. Overall, this case shows how corrupt the healthcare industry can be and how easy it is for providers to take advantage of vulnerable patients, specifically by failing to take into account their ethical responsibilities.